Hi guys, welcome to the calming shores of Dr. Puja Opal. Today we get to discuss celiac disease. As many of you know, celiac disease is not simply just a GI manifestation, and Dr. Opal is here today to give us 6 other common facts about celiac disease. All right, Dr. Opal, why don't you begin? 6 facts about celiac disease. Number 6.
All right, number 6. Celiac is also an artery in your stomach. It's a artery more accurately that is, it's an artery that comes off of your abdominal aorta, and it supplies blood to the top portion of your small intestine.
Okay.
People who have celiac disease have damage in their small intestine, and typically that's seen by pathology, and that's called blunting of your villi. And that part of your small intestine is supplied by an artery, and then that artery is called the celiac artery. Typically, we have people, a lot of diseases in medicine are sometimes named after doctors that have, discovered a certain disease. It's kind of interesting. There was no Dr. Celiac.
All right, Dr. Opal, let's move on to 5. Pooping and shitting are not the only symptoms of celiac disease.
When celiac disease or patients were first, the medical community, when we first were looking at celiac disease, the main symptom that we were taught in medical school and as residents in training to become, physicians, is that your patient must poop and shit. And if he does poop and shit, he or she has celiac disease.
Yeah, that makes sense. So I remember that article we read from 1936 where they spend the entire paper discussing the look, smell of poop, and they make no reference to the extra GI symptoms of the disease. Can you just talk about XGI for a second, and then we'll move on to the rest of the list?
Sure. So, extra GI celiac disease basically are a bunch of symptoms that patients can have because of celiac disease, but not really have any diarrhea or excessive pooping.
Okay.
One of the most common things would just be arthralgias. Arthralgias is basically just joint pain. It is joint pain similar to other types of arthritises, and just generalized muscle pains, which we call myalgias.
All right.
Peripheral.
So the idea is, let's not look at the quality and type of poop as a symptom of celiac disease. There are other manifestations of the disease.
Yes, there are definitely other manifestations of celiac disease besides just having steatorrhea. So let's go to number 4.
Sure.
All right, now we'll talk about number 4. Celiac disease can and does affect your reproductive system. This is a disease process that affects both men and women when it comes to infertility.
Right.
A man may not be able to conceive a child because of celiac disease. A woman also may not be able to conceive children because of celiac disease, and typically what we see is premature ovarian failure in the women. And in men, we would see hypogonadism, which means that they're not making enough of the male hormones needed in order to produce sperm. When we talk about celiac disease, the other way that it can affect women with their pregnancies is that it's one of those diseases that can also cause miscarriages. Typically, when we look at autoimmune diseases, they either will cause infertility or they have a higher chance of causing miscarriages. Celiac disease is one of those things that can cause both of those. So you can get pregnant, but then it doesn't mean that you're out of the woods. You actually may have a higher chance of getting a miscarriage.
All right, so you're at a higher risk of spontaneous abortions if you have celiac disease.
If you have some, definitely. So what happens is the antibodies actually attack the placenta. So these are those antibodies that your body produces against eating wheat. You just have a lot of those antibodies. It's a tissue-specific antibody, which means that it destroys tissue in your body, hence the name anti-tissue transglutaminase.
Okay.
So a woman who's pregnant, her antibodies, if she has celiac disease and doesn't know that she has celiac disease, can actually start attacking her placenta.
So her body attacks her own placenta, and that leads to the spontaneous abortion.
That's right, and it leads to death of the baby.
Okay, all right, great. So we'll move on to number 3. All right, for number 3, we'll talk about bone disease. In celiac disease, patients tend to exhibit symptoms of weakening bones, and this begins from a very early age. So, Dr. Opal, please tell us more. So, Dr. Opal, please tell us more.
Yeah, this is kind of really interesting because, you may have a lot of kids who have broken bones, and that's kind of normal. It's part of normal aging because every little kid will break a bone. But sometimes the only symptom that you see of celiac disease is a broken bone, like a broken arm or a broken leg in a little kid who's like 4 or 5. Um,
So, does he spontaneously break them, or is this through physical activity? I mean, when does a parent say, "Hey, this type of bone breakage is different than another"?
Right. The interesting thing is that our medical community doesn't have a specific number that says that, if little Timmy has broken an arm,
Timmy.
yeah, that little Timmy needs to go to see his doctor. We don't have guidelines that tell parents that. But what we do know in celiac disease is that it causes premature osteoporosis and osteopenia.
And it shows as early as say 4.
Yep, it can show as early as age 4.
Wow.
Typically, what we used to think is that we're getting bone damage because patients with celiac disease are not absorbing the appropriate amount of calcium. But that theory has been proven incorrect. It
Okay.
is actually that freaking antibody against gluten which causes the damage. So
Sure.
it prevents your bone from properly forming and it becomes like a bone of like an old lady and you're more easily able to break it.
Understood. So we'll keep an eye on for broken bones.
Yes.
All right.
Bye, Timmy.
All right, doctor. Let's talk about anemia. One of the most common non-GI symptoms, non-gastrointestinal symptoms of celiac disease is anemia. Tell us more.
Yeah, so to be precise, it's called microcytic anemia. And it's because of an iron deficiency in the patient.
So this isn't gene-based, it's disease-based.
Exactly. So gene-based would be things that are different, different diseases. So what comes to mind is beta thalassemia, which is a genetic disease that can cause anemia. A lot of people from like the Mediterranean region typically would have it. So if you are diagnosed with anemia, sometimes people actually ignore that because with women who are of menstrual age, they consider it to be a normal part of life that because I am having so many amounts of menstrual cycles per year that it's okay to be anemic because I'm just losing the blood. That's very incorrect.
Okay.
Even if you are not able to get that from your diet, sometimes you can have anemia because you're not eating things properly. But anemia is one of those things that can actually cause heart failure. It can cause you to be short of breath. It can cause you to be cold all the time. It can even cause you to lose your hair. You can get thin, brittle nails from anemia, just kind of be tired and fatigued all the time.
All right. So the takeaway message is if you have anemia and it's not based off any specific disease, think about celiac disease or have further studies done to rule out.
Yep, exactly. The take-home message would be that number one, anemia is not normal. Number two, if your doctor says, "Hey, Bob, you have anemia,"
Bob?
or Jane, to my female listeners, if Bob or Jane, if either of you have anemia, don't just take that as a diagnosis and don't come up to your follow-up appointment.
Sure.
Let your doctor figure out why you have anemia, because there are many reasons for you to be anemic, and one of those reasons is just simple celiac disease.
So again, just to belabor the point, men and women can be anemic. It's not a women-specific disorder.
Yes, that's very true. Both Bob and Jane can have it.
Excellent. All right, so this has been a great discussion. Let's wrap this up and talk about the most common symptom of celiac disease, fatigue.
Yeah.
Doctor, tell us, why am I so tired? Am I lazy?
Probably not. There are many, many, many medical reasons for why somebody can be fatigued. Like simple mono can cause somebody to be fatigued. Simple hypothyroidism or just not drinking enough water or, just always pounding down on coffee are things that can cause you to
Be fatigued.
be fatigued.
All right.
We necessarily don't know why celiac disease causes you to be fatigued, but this is what I recommend to all of my patients.
Okay.
Again, I don't want you diagnosing yourself with celiac disease. I think it makes sense for you to go to a doctor and let them figure out why are you fatigued.
Okay.
If everything else is ruled out, you don't have hypothyroidism, you don't have any other reasons for your fatigue, I would recommend that you talk to your doctor about celiac disease, as this is the most common symptom for it.
Now, is it fair to say that fatigue is a manifestation of other autoimmune diseases as well?
Yeah, this is something that we typically see. I mean, in an MS patient, multiple sclerosis, you will see fatigue when they are in a flare. People with lupus who, interestingly about lupus, if I can just make a tangent, a
You must.
person that has celiac disease has a 3 times greater risk than a person that does not have celiac disease to develop lupus.
Okay.
Typically, we see lupus more among women than men in the general population. But among people or among patients of celiac disease, there is no difference if you're a man or a woman.
Hmm.
You still have a 3 times greater chance of getting lupus.
All right. So the takeaway message: if you're tired, get that checked out.
Yeah, figure out why you're tired and don't just keep slamming those 5-hour energy drinks. I mean, that's not the
Yeah,
answer for,
absolutely.
yeah.
All right. So this has been great. We look forward to more podcasts from you on celiac disease and other general disease issues. Thanks for coming.
Yeah, thank you for having me. It was a lot of fun.
All right, Dr. We'll talk to you soon.
Bye.
Cheers. You've been listening to the Calming Shores of Dr. Opal. Calming Shores comes from the Scarborough brothers. You can check them out at earwolf.com. Quick medical disclaimer: this podcast, does not replace medical advice, diagnoses, and treatment of your doctor. Please consult your physician for further information. Copyright statement 2013, Puja blogs.wordpress. That's PUJABLOGS.wordpress.com. Bye bye.
Kids, say no to drugs.
No drugs.
No
Bye.
drugs, ever.